Hi everyone, I'm Rewadi from the University of Selangor, a student of Medical Laboratory in Faculty of Engineering and Life Science will proudly present a case study on the topic of possible complications of influenza type A on infants. So the aim for this case study is to create awareness of possible complication of influenza type A on infant patient. Next, we move to the introduction to patient background. In this case, a 1-year-old male patient has came to hospital with his parents and was referred to pediatric ward. Past history has reported shown that the patient suffered with jaundice in early born but already recovered. Next, we move to the overview of illness. The symptoms of this infant was such as he is vomiting, having a diarrhea, facing with a high-grade fever but without flu. He is also diagnosed with dizziness and lost appetite. The patient also came with the symptoms such as a chill, malaise, and watery eyes. It has been indicated as a serious case as the patient having a high-grade fever. So here we can see the chronology of the case was as below. On the 5th January, the patient came with his parent. The patient was 1 year old and the parent told the doctor that their son was vomiting up to 5 until 6 times per day for 1 week and having a diarrhea around 5 up to 7 times per day for the last 5 days. Then the doctor diagnosed the infant to have a high-grade fever with cough but without flu. On the 6th January, the patient still having a high-grade fever with flu, but he has been warded in hospital since the 5th January. The doctor then ordered a full blood count test on the 6th January. Then the full blood count test had shown the increasing in amounts of neutrophil, which means there is infection happen inside the body, and then comes also the inflammation. The red cell counts also slightly high compared to the normal range. The platelet count also higher compared to the normal range. And in the addition, the urea electrolyte test also was ordered. The test showed no significant result, which show a patient was well hydrated at that time. Furthermore, there is negative result for rotavirus antigen test and stool for ova and cysts. It is indicated that the patient are not having rotavirus antigen, although he having diarrhea for a few times in the previous day. And it's also found that there are no harmful bacteria in the stool culture, which means that diarrhea and continuous vomiting was not caused by the rotavirus or other harmful bacteria. And on the following day, the patient still vomiting and having diarrhea but was slightly recovered. The patient was still coughing but having flu at this time. Influenza rapid test, which comprised of influenza virus type A antigen, influenza virus type B antigens, and influenza virus 2009 pandemic A H1N1 antigen was ordered on that day, and the result was shown that the patient was diagnosed to be positive influenza virus type A. So Now, in order to prevent the influenza A from spreading to other patients and visited relatives in the ward, the patient was quarantined in a special pediatric ward to avoid the outbreak of the influenza, and then to monitor his condition from day to day until he was fully recovered. Then the treatment given by the doctor is Tamiflu, as the patient was diagnosed with influenza type 1. Because why? We're using the Tamiflu. Tamiflu is an antiviral medication that blocks the action of influenza virus type A in patient body. But it's sometimes used to treat the people who have had symptoms for less than 2 days, and can also be given to prevent influenza in people who may be exposed but do not yet have symptoms. Then the patient was discharged on the 8th January. So now, gold standard for flu testing has been a viral culture. It highlights the advantage of practicing further PCR, or we known as polymerase chain reaction analysis, as initial identifications of influenza infection, and the standardized RT-PCR protocol exists to look for the presence of different hemagglutinin and neuraminidase subtypes like chiefly H1, H5, N1s, and N2. If the PCR polymerase chain reaction analysis indicate a dangerous strain of influenza A, like H5N1, then it is instantly sent to which a reference laboratory for further tests. Okay, and then the doctor can considering the possible complication in infant with influenza, and then will urgency in initiating the treatment to the patient. Okay, we move to the opportunity for discussion, where we should create awareness that influenza type A can have serious consequences and be fatal to previously well children if not treated earlier. Then the rapid influenza can give the fast and accurate result with help to diagnose the disease earlier. Based on all the data collected and diagnosed, the patient was diagnosed with influenza A and dehydration. A sign and symptoms such as vomiting, diarrhea, and flu is a common symptom for various kinds of disease, but normally by infections. In order to diagnose what is the cause of the disease, various tests are needed to perform in order to identify the cause of the symptom. Then after that, a suitable treatment can be given to the patient. And in this case, influenza rapid tests show a positive result in influenza A, but however, this test only have 60 up to 70% chance to detect the virus. If the test gives a negative result, influenza culture should be performed because it has 95% test chances to detect influenza virus antigens. Alright, that's all for my case study presentation today. Thank you very much for listening and giving attention on my topic today.